live on YouTube and should be live on Facebook. Let me intro us. Hi, welcome to another edition of Truth with Teeth. Today is August 7th, 2019. My name is Reese. As always, I am joined by Dr. Kumar T. Vadivel. He is a board-certified surgeon practicing as a periodontist specializing in periodontology, dental implants, and oral surgery in the Dallas-Fort Worth area. Dr. V holds a master's degree in dentistry from the University of Minnesota and is a fellow of the Royal College of Surgeons of England and Edinburgh.
Thank you, Reese, and hey all. I'm so glad you are able to join us tonight, and we are very excited. We have so many users. They have submitted a lot of questions from multiple online websites and social media and all of that. So we are very excited to have you all, and we look forward to a great show tonight.
Mm-hmm.
Fantastic. Thank you, Reese.
All right, so let's just dive right in and get started with our first question, which comes from us from Cora. And let's see. First question is, can removing wisdom teeth or any other tooth cause bone loss?
The answer is yes. To removing a tooth, can it cause bone loss? Yes, it will cause bone loss, particularly the way the tooth is removed. As a surgeon, as a periodontist, this is what we do all day long, and we remove the teeth very, very carefully, as if the tooth removal does not damage the bone at all. But if the tooth removal is not done correctly, then it may end up causing some damage to the bone, which will create bone loss. And not only that, after removing the tooth, no matter who does it, whether you're a dentist or a specialist or me or somebody else, over a period of time, because there is no tooth there and there is no function of that tooth in that bone, so you will end up having bone loss. So you will end up having bone loss no matter whether the tooth is removed carefully or not. And also, to answer the second part of the question, can removing the wisdom teeth cause bone loss also? Yes, because it is a site where you had the tooth, so that will end up causing some bone loss also. Mm-hmm. But the good thing is the wisdom teeth, they have a memory in them, so they don't lose as much of a bone as the other teeth do. So eventually, because it is a back tooth and you on the wisdom teeth side, you are not going to replace that wisdom tooth at all. Even if you end up losing some bone, you don't have to worry about it. Whereas on the other teeth, you are more concerned because that tooth will need to be replaced to keep the other teeth intact. So you want to make sure that there is no bone loss around the site. So the bottom line is, yes, tooth removal will cause bone loss.
All right. Let's move on to our next question then. This one comes from Facebook, and it is from Elizeth Rodriguez. And their question is, what is the treatment for periodontal disease?
So the question is, what is the treatment for periodontal disease? So to begin with, the periodontal disease, some of you may or may not know this. Periodontal disease means gum disease. The gum disease happens to the bone as well as the gums around the teeth. So in other words, although it is called gum disease, it not only destroys the gum tissue around the tooth, but it also destroys the bone that is underlying on the gum tissue. So you will get gum disease and you will get disease to the gum. When you get gum disease, you will get some disease to the gum as well as the bone. And the eventual problem with the gum disease is if you leave it untreated, and you will end up losing the tooth. So how do we treat the gum disease? So the way you treat the gum disease, if you have, depending on the type or the severity of the gum disease, it could be as simple as, in layman term, we call it as, it could be as simple as gingivitis, which may be cured or which may be treated very easily just with the regular cleaning. But in periodontal disease, we have early, moderate, and severe. If you have early periodontal disease, it can be very simply cured with what we call it as a deep cleaning. When you have severe or when you have a moderate to severe gum disease, Sometimes it may not be treatable just with doing some deep cleaning. In that case, you may need what we call it as a gum surgical procedure or a laser gum surgical procedure that need to be done. When you have very advanced disease, then that cannot be treated either with the deep cleaning or with even the laser gum surgery or a conventional gum surgery. You may end up having to lose some teeth, or you will end up needing to lose some teeth along with need for some kind of a bone grafting. So to answer your question, what is the treatment for periodontal disease? Depending on the type of disease or the severity of the disease, the periodontal disease or the gum disease you may have, it may range anywhere between doing a regular cleaning up to losing the tooth and having a bone grafting.
Okay. Well, whatever treatment you need, come on down here. We can help take care of you.
Thank you. Yes, sir.
All right. Let's see. Let's go back to Cora for another question, number 2. Can your partner's oral health affect your own?
So the question is, can your partner's oral health affect your own? So a lot of times we see patients in our office. This is one of the common questions that comes up. If I kiss my partner, can I contract gum disease if my partner has gum disease? Or if I have gum disease, can I share that gum disease with my kids or my family, other family members? Yes, absolutely. The answer is yes. So if your partner has gum disease, the likelihood of you contracting gum disease is very likely. Think about this. Gum disease or periodontal disease is caused by the bacteria. So imagine this. If your partner or someone in your family, your kids, have a common cough or a common cold which is caused by the bacteria or the virus, and the chances are, or the likelihood of you getting it is very likely, correct?
Mm-hmm.
So the same way, if your partner or someone in your family has gum disease, which is a bacterial disease, yes, the chances of them giving that periodontal disease or gum disease is very likely. And for that fact, we always offer screenings for the family member. When one of the family members has gum disease, we always recommend the other family member getting screened for gum disease. And also, we always recommend, hey, do you want to give this gum disease to your kids? For example, like when I sit on the dinner table, my kids, come and say, Daddy, can I taste the ice cream? Daddy, can I taste, the food? So when I'm sharing the same utensils, then I'm passing the germs on to them. So you definitely want to you don't want to pass on this to your friends or the family or your partner. So you definitely want to prevent that by getting the gum disease treated, and not only just getting treated, gum disease under control, so that way you don't pass it on to anybody else. So to answer your question, can your partner's oral health affect your own? Yes.
Absolutely. So if you or your partner need some treatment done, come on down. We can take care of you, your partner, your whole family, anybody.
Yes, sir.
All right. Let's see. Next question. Back to Cora again. How can a person with dentures still have a toothache?
So the question is, how can a person with dentures still have a toothache? I'm not really sure what this reader is referring to. So the only thing that I can comment on is what I commonly see in my practice. For example, like I saw a patient a couple of days ago, and the patient had all the teeth removed, but then the reason the patient had the teeth removed is because the patient had some toothache to begin with. Now the patient complains that, hey, I had all the teeth removed, but now I'm wearing dentures. How come I'm still feeling the same type of toothache? So what happens is, after you remove the teeth, when you put the dentures on, it may be some kind of a bone spur that you have. The denture is not getting seated correctly, or you have the dentures kind of rocking and you're not having a comfortable denture that you're able to wear, because the bottom line, the bone is not smooth enough. So in that case, you may need to have the bone kind of smoothened before you start wearing the denture, which may feel like, or which may translate it to some kind of a toothache, although you don't necessarily have the tooth. And a lot of times we also see the regular denture, which is what I normally call it as a grandma denture. It's almost like a flip-flop. So it moves. I don't know how well you can see on the camera. It moves like this. When you move it, when it moves like this, then you cannot wear the denture comfortably. Now you got some pain. Now you are thinking it is a toothache. It is not necessarily a toothache. You are getting the ache and pain from the gums or from the bone. So what we normally recommend on those situations, instead of having a regular denture, have what we call it as an implant denture. See, it doesn't flip-flop. You got to really pull it out. So then when you snap it in, you snap it in like that. So now it is not like a flip-flop. It doesn't move, whereas the regular denture moves like a flip-flop. The implant denture does not move. So if you have recently had teeth removed, or if you have an ongoing issue with toothache-like symptoms, but you have a denture, the likelihood of having you any kind of bone problems or the denture stability problem is very likely. So talk to your dentist and they will be able to see whether you need any kind of a bone trimming or you may necessarily need implants. And if you happen to be in the Dallas-Fort Worth area, come see us and we'll be glad to help you.
Absolutely. All right, let's see. Moving on, let's do another question from Facebook. Let's see, number 6 here. Why do most oral surgeons require all 4 wisdom teeth be pulled at once?
So the question is, why do most oral surgeons recommend or require to have all 4 wisdom teeth removed? Okay, so there are multiple reasons, and the likelihood of if you having problems with one tooth, and when you have all 4 wisdom teeth, the likelihood of those wisdom teeth, the other 3 wisdom teeth, causing problems is very likely. So for all practical purposes, think about that. Coming to see a surgeon is kind of sometimes could be some kind of an anxiety issue. People have conflicting scheduling issue, and people don't want to be like just recovering from procedures 4 different times. So for all practical purposes, we recommend, as oral surgeons, we recommend getting all 4 wisdom teeth removed in one time. Having said that, can you remove one at a time? Yes, you can, but think about that. If you're going to have 4 teeth removed at 4 different times, you got to recover 4 different times. You got to take antibiotics and pain medications 4 different times. You got 4 different visits. Then you got 4 different follow-up visits. Whereas if you're going to be here, and also if you are going to be sedated, which is the most common thing most patients want to do, if you are going to be sedated, you're not even going to remember what things exactly happen or how things happen, and you wake up, all 4 wisdom teeth out, and you recover, you take pain medication and antibiotic once, you recover once, and be done with it. After like about a couple of days, you forget about it and move on. Whereas if you're going to have these procedures done at 4 different times, you got to repeat the whole thing over and over. And think about the cost also. If you're going to be removing all 4 teeth, and particularly if you want to be sedated, then you're adding the cost of the sedation 4 different times. And then a lot of times if you have an insurance plan that you're working with, to be able to be put to sleep for 1 tooth, the insurances do not allow that. So whereas with the 4 teeth, they do allow sedation to be done. So for maximizing the benefits, to get the best bang for your buck, even if you don't have insurance, the best bet is to be put to sleep, get all 4 wisdom teeth removed. And as you know, Reese, in our office, to get all 4 wisdom teeth removed, we offer sedation for free. For example, even the IV sedation comes for free. So if you happen to be in the Dallas-Fort Worth area, come see us. We can definitely help you. That way you get you maximize your time and also maximize your recovery, and also you get the best bang for the buck. And plus, if you have insurance, then we can maximize your benefits also.
All right, that question came from Miss Phyllis Harris. Thank you, Phyllis. Next question, let's go back to Cora. Let's see. Can you get a dental implant for your front tooth before getting braces?
So the question is, can you get a dental implant for your front tooth before getting braces. So depending on what your goal is. So if you think that you have some crooked teeth, then if you want to align, if you want a perfectly looking teeth, then my recommendation is always to get the braces, always adjust the spacing before you get a dental implant. Whereas, if you're not concerned about the braces, or if you're not planning to get braces in the immediate future, and you lost a front tooth, then you want to have something done, then can you get a front tooth with an implant before you get braces? Yes, you can do that also, but there is going to be some limitations, as if the teeth are going to move with braces, but the implants are not going to move. They are a solid structure. So if you plan to do any adjustments after, then that cannot become an ideal situation, and you may end up having the implant to stay in one position. You may have to move the teeth around. So my recommendation always is to get braces before you receive the implant, whereas the implant can be done before the braces. Yes, the answer is yes, and the results may vary depending on what your goals are.
Alrighty, let's see. Next question, let's do another core one. Number 7 here. I grind my teeth in my sleep. Is it safe for me to go for dental implants with this condition?
So the question is, I grind my teeth, is it still possible for me to get an implant? The answer is yes. I do implants on patients all day long, and I do implants on patients who grind their teeth. However, the reason it is critical for you to know why you may have an issue if you do grind your teeth. So we always tell my patients, the teeth, they always have what we call it as a cushion, or almost like a shock absorber. So whenever you bite down, so the teeth kind of, without you knowing, they go kind of in and out. It's almost like, if you think of a high-rise building, and they say, on a heavy wind, the building kind of flexes, so, and inside, if you happen to be inside the building, you may not feel the building flexing, but it happens no matter what. The same way, although the teeth, you don't feel like they're really moving, whenever you bite down, because of the shock absorber action, they kind of go in and out. Whereas with the dental implant, you don't have that shock absorber. It's like the bone, it's completely glued to the implant, so they don't move. So if you do grind your teeth, they kind of have a little bit of a flex, and you don't have any problem with that, and you may have a little bit of a wear and tear on the tooth, and you may be fine. However, with the implant, because the tooth is itself as a metal, or what we call as a porcelain teeth, so you don't get that much of a wear. So you get the forces completely translated onto the bone, and then it is going to strip the bone bonding around the implant. You may end up damaging the implant, causing some bone loss around the implant, or you may end up completely losing the implant. So my recommendation is, if you are a heavy grinder and if you are concerned about losing bone or losing the implant, after you finish the implant treatment, always get a night guard. I always recommend for anybody who grinds their teeth, whether you have implants or not, we always recommend getting a night guard or a sports guard if you're going to get an implant, and that even there is a better reason to why you want to preserve your investment by definitely getting a night guard. So the answer is, can you get an implant while you grind your teeth? Yes, you can get the implant, but finish the process by getting a night guard after you getting the implant.
Mm-hmm. All right. Let's see. Next question. Number 11 here. How long does it take to replace my complete teeth using dental implants?
So the question is, how long does it take to replace my teeth, or complete set of teeth, using dental implants? We do this all day long in our office, and sometimes it could be a simple process. It takes about 3 months, or we call it even the same day teeth. You can come in, you can get all the teeth removed, you can have implant placed, and then you can get the teeth on the same day. which may be temporary teeth. By the time you finish that with the permanent teeth, it may be about 2 months to 3 months. Or sometime we got patients who have severe infection of the mouth. You can't even place or imagine placing an implant. So now you got to remove the teeth, do some bone grafting, let the bone completely heal before you go back and place the implant. In those cases, it might take up to about 9 months or even a year. And I got patients, they're waiting for almost like over a year and a half to 2 before they receive the final implants. So the short answer to your question is to do a complete set of teeth or to replace your complete set of teeth. It could be as low as about the same day, or it could be as long as about a year and a half to 2. So that really depends on the case.
It really varies. All right, let's see. Back to Cora, number 8. Can dental prostheses, fillings, implants, crowns, cause cancer?
So the question is, can the dental prostheses or dental materials such as fillings, implants, or crowns cause cancer? In the olden days, we used to believe the chronic irritation from any type of fillings or any type of metal in your body can cause cancer, but it's not a common thought anymore. So the chances of your filling, the chances of your implant or a crown causing any type of cancer is very unlikely. However, having said that, if your filling or a crown or your implant causes an allergic reaction onto the skin, the adhering skin or the adjacent skin, and can that skin or the irritated skin become cancer? Again, the likelihood of that becoming a cancer is very unlikely. However, if you are a smoker, or if you are an excessive smoker, or if you drink excessively, then those become kind of a risk factors. Now you have an open or a raw wound, then now that becomes kind of more prone to absorbing the tobacco or absorbing the alcohol to become cancer. So that's why you got to be very careful. So you don't want your filling or your implant or the metal to be causing some kind of a reaction to the skin. Now you got an open wound which is going to be more prone for cancer. So can you connect the dots to a filling or a crown or an implant causing cancer? Possibly yes, but the straightforward answer, would an implant or a filling or a crown cause cancer? The answer is no. However, you can connect the dots, particularly if you're an excessive smoker or you drink excessively.
Yes, sounds like bad dental habits really.
Possibly, yes sir, correct.
All right, let's do another Cora question. I am currently undergoing radiation for my illness. Can I go for dental implants now?
So the question is, I'm undergoing radiation for my cancer. Can I get dental implants, or am I a good candidate for dental implants? The short answer is no, for a variety of reasons, particularly for the reason, if you're going to get even dental extractions done when you're undergoing radiation, you cannot have dental extractions done because your bone is so fragile. You cannot have dental extractions done because you're not going to be able to heal properly. Can you get a dental implant once you heal completely from the radiation, once your bone heals completely from the radiation? Can you get a dental implant done safely? Possibly yes, again depending on the dosage that you are going to receive. That is going to be a discussion that we may need to have with your radiation oncologist, depending on the radiation, the type of radiation and the dose of radiation that you need to receive, and we can decide on the timing whether we can safely place an implant, like let's say for example 6 months after, or 12 months after, or a few years after the radiation. That's the type of discussion we will need to have with your radiation oncologist to see whether you are a good candidate or not. So the short answer to your question is, can you receive a dental implant after radiation? Possibly yes, depending on your condition.
Sounds like it really depends on how
Yes,
healthy
sir.
you are.
Yes, sir.
All right. Let's go back to Facebook for another question here. This one comes from Miss Mary Varela. Her question is, I have bad gums. Can I get implants?
So the question is, I have bad gums. Can I get dental implants? Great question, by the way. So one of the most common reasons why we remove teeth in my office is because people have severe gum disease. Can these patients or do these patients get implants? Absolutely yes, every single day. We get patients all the time. So let's say, for example, if they have a localized gum disease on a single tooth, and if that happens to be the advanced gum disease, we remove the teeth, we make sure we get the gum disease under control overall, then we can definitely replace that one single tooth with a dental implant. However, let's say they got some severe gum condition on one tooth, and then they got overall gum disease on the rest of the teeth. We may remove that one tooth and replace it with bone graft. However, we cannot place that implant without getting the gum disease under control. Imagine if you have, let's imagine this one wall gets infested with termite, and you may have some severe termite damage, but you don't want to replace this wall without treating the termite for the whole room. So you want to get the termite under control before you replace this one wall, or you want to kind of like make the wall look better. So the same way, you don't want to end up removing a tooth because you got some severe periodontal disease or the gum disease, and end up now having the other teeth or the gum disease from the other places spread to this new implant. So if you have severe infection, remove the tooth, treat the infection, do the bone graft, and get the gum disease under control on the rest of the mouth by doing either some deep cleaning or a gum surgery, then before you replace this one tooth with a dental implant. So the short answer to your question is, if you have bad gums, yes, you can still receive implants. Again, depends on the condition. If you have isolated area, then you can treat it with a dental implant, or if it is generalized to your mouth, get the gum disease under control before you replace that one tooth.
Sounds like you got to take care of the problems first, then you can do all that nice stuff.
Absolutely. Yes, sir.
All right. Back to Cora for some questions. Let's see. Number 12. What causes bad breath after wisdom teeth removal? How is this to be treated?
So the question is, what causes bad breath after wisdom teeth removal? How is this to be treated? So think about this. You're getting a wisdom teeth removal. Particularly, we do this in our office. Like I said earlier, we get all four. Most of my patients get all four wisdom teeth removed at the same time under sedation. So when they are going to get all four wisdom teeth removed, they're going to be pretty swollen, a significant amount of swelling depending on how deeply those impacted teeth are. So they are going to have some swelling. Now they are not going to be able to open their mouth wide, particularly for the first couple of days. So now if you are going to eat anything, including any soft food that you may eat, they're going to get pretty just impacted down here. So they are going to get really stuck onto the hole the wisdom tooth is going to come out from. So think about this kind of food that's staying in the back, getting stuck. So they are going to cause some bad breath eventually. And sometimes you may have a healing socket. Think about if you have a nice piece of big wound on the skin, so that skin is not going to smell pretty. It is going to smell bad. The same way, you're going to have all four wisdom teeth kind of pretty cut open. Now they're healing. They're going to cause bad breath whether you're going to have any food getting stuck there or not. So it may be because of the food, or it could be because of the healing process. Sometimes you may have some infection that is causing the bad breath. So it could be a variety of reasons why you may be getting the bad breath after the wisdom teeth removal. So I wouldn't be too concerned if you're having bad breath for a short period of time as soon as after the removal. However, if you happen to have bad breath that is continuing after 2 or 3 weeks, then that's when I would be concerned about, because you may not be healing properly.
All right. Let's keep moving on. Let's see. Let's go to number 17 here. I am 51 years old and planning to go for dental implants. Which is better, all on 4 or all on 6?
So the question is, I am 51 years old planning to get dental implants. Can I get an all on 4 or should I get an all on 6? Which one is better? The short answer is it can be either way. It can be an all on 4 or it could be an all on 6. So that depends on who is going to do it and why they recommend you do it in a certain way. So I have patients in my office. I do all on 4 pretty much all day, or sometimes I do an all on 6. For those who may not be familiar what an all on 4 or all on 6, this is, for example, you got 4 implants in this model, 1, 2, 3, 4. You do the prosthesis on the top, either fixed or removable, that becomes an all on 4. Sometimes you put 6 implants, then you do the prosthesis either removable. More than likely, if it is going to be 6 implants, it will be a fixed prosthesis. You do a prosthesis on 6 implant, that becomes what we call it as an all on 6. Whether you can get a prosthesis on 4 implants, whether you can only get a prosthesis on the 6 implants, depending on a variety of reasons. What the surgeon feels comfortable, what your oral hygiene habits are, whether you are a smoker, whether you drink excessively, whether you have any medical conditions, whether your dexterity is so poor you cannot do a good job with a particular type of prosthesis you may have, or whether you have good bone support. Those are going to be the determining factors to whether you can get an all on 4 or an all on 6. So it is a type of discussion you will need to have with your surgeon who's going to be placing the implant, and with the prosthodontist or the family dentist who's going to be doing the prosthesis, whether you are a good candidate for an all on 4 or an all on 6.
So would you say there's any disadvantages or advantages between the all on 4 and all on 6?
Not really. What Reese is saying, whether there is any disadvantage of getting an all on 4 or an all on 6, both the prostheses are going to be doing the same job. If you are going to get, like, let's say for example, which is a common fixed prosthesis, you're going to have either an all on 4 or an all on 6. There is not really a big advantage of one versus the other. It's just a preference, and like I said, your condition kind of dictates whether you need to have an all on 4 or an all on 6.
All right. Let's see here. Next question. Let's do number 14 here. I am 18 years old and my incisor teeth are broken. Can my teeth grow again? If not, what are the alternatives?
So the question is, I'm 18 years old and my incisor teeth are broken. Can my teeth grow again? If not, what are the alternatives? So if you're 18 years old and if your incisors are broken and those are your permanent teeth, and they are not going to grow at all, period, 0. So your only options are at that point, the first thing, even before thinking of the option, you don't want to leave a broken tooth there. So if you're going to have the broken teeth left over, you're going to get infection, and you're going to have pain, and you're going to have swelling, and you're going to go through the misery of leaving that broken tooth in the mouth. The least that you want to do is to remove the tooth and preferably get a bone grafting, because you don't want to end up losing the bone. So that's the option, at least to get you out of pain. So after you remove the tooth, what are the options you have? Of course, you can do nothing, but you don't want to be going around with a snaggle tooth and end up having a missing tooth, not being to smile. So you want to have some kind of a tooth replacement. So the options that you have now are having what we call it as a flipper, or like a partial denture that goes in and out. And again, this is not the best option. And then one of the other options that we have is what we call it as a dental bridge, which is grinding the two teeth on either side. So particularly if you have both incisors broken, now you don't want to grind the two teeth on either side and then end up having a 4-unit bridge. That is not going to be a good situation, because now you're going to end up having 2 teeth do the job of 4 teeth, particularly those 2 incisors on the side are going to be smaller, and now down the line in about 3 to 5 years you're going to end up having problems with all 4 teeth, and you're going to end up having all 4 teeth, you're going to end up losing all 4 teeth. So the best option would be to replace them with what we call as the dental implants. So all for all practical purposes, you put two posts on the teeth in the bone, and then you end up putting 2 crowns on them, just like you see here. So you end up putting 2 posts on there, and then you put 2 teeth, and then you're done. So dental implants will be the best option. To answer your question, so you definitely need to have the teeth removed. Your teeth are not going to grow. The options that you have are a partial or a flipper, or a dental bridge, or dental implants.
All right, so for any of those options that you're interested in, come on down here, give us a call, set an appointment, we'll take care of you.
Absolutely, yes sir.
All right, let's see, let's go to the back here. Let's see, question number 40 here. What is the difference between veneers and dental implants?
So the question is, what is the difference between veneers and dental implants? So the dental implant is a replacement for a lost tooth. The veneers are something that are to improve the cosmetics or improve the looks of your teeth. So those are completely 2 different animals. So veneers are something that is done for the existing tooth structure, but the dental implant is to completely replace a tooth. So let's say, for example, if you have a missing tooth, you cannot have a veneer. Whereas if you have a chipped tooth, for example, or a broken tooth, can you get a veneer? Yes, the answer is yes. However, if a broken tooth is completely broken at the gum line, you cannot have a veneer. You need to have a dental implant to replace that tooth. So, like I said, those are completely different animals. If you have a slightly broken tooth, the chances of you getting that tooth looking good is to get a veneer. But if you have a completely broken tooth or a missing tooth and you cannot have the veneer, the only option is you need to have a dental implant.
All right. Let's see here. Back to Cora for another question. Let's see. Number 18 here. When is jaw surgery indicated?
So the question is, when is jaw surgery indicated? So sometime or a lot of times that we see in our office, patients are looking to correct the looks of their teeth, or correct the looks of their face. Sometimes if you look at my face, for example, my face kind of has a profile like this. Sometimes the profile can be opposite. My jaw may be looking like this. It is protruding forward. So if it is protruding forward, there is, to a degree, you can correct that by having braces. And if you think that your condition can be corrected after discussing with your dentist or the orthodontist, who's the brace specialist, if the profile can be corrected just with the braces, then that's great. You don't need to have a jaw surgery. However, after discussing your options, and if your orthodontist strongly believes that the profile, which is what you may be concerned about, cannot be corrected with the braces, then your orthodontist may recommend it has to be either corrected only by jaw surgery, or it could be a combination of you need to have the braces followed by the jaw surgery. Then that's the time that you need to have the jaw surgery done. That is when the jaw surgery is indicated. So to answer the short answer to your question, when is jaw surgery indicated? When you have a profile issue or when your teeth are not meeting correctly, and if your orthodontist believes that this problem cannot be corrected just with the braces, either it can be corrected just with the jaw surgery alone, or it could be a combination of orthodontics followed by the jaw surgery.
Interesting. All right, let's see. Let's do question number 31 right here. What are the advantages of teeth alignment treatment?
So the question is, what are the advantages of teeth alignment treatment? So most patients tend to think it is just a cosmetic issue, and it is not. So the reason why you need to have the teeth aligned is for a variety of reasons. One, if you have the alignment of the teeth are not good, sometimes the alignment may tend to cause some kind of a gum receding. As gum specialist, I see a lot of times the teeth are not aligned properly. Now the patients have some severe gum receding. Sometimes we see a lot of gum disease on patients who are not the teeth are crowded. For example, if you have all 4 teeth just like this straight, and the chances of when you brushing and to keep them clean is very likely because they are all in a row. What if they are crooked, all 4 like crowded like this, one inside, one outside like that? Whenever you're brushing, now you're not going to be able to keep them clean, and unless you're really, really vigilant, then the chances of you getting some gum disease is very likely. So it is again not for vanity reasons or cosmetic reason. Now you need to have braces. Now you need to have them corrected to be able to keep them clean. And of course the vanity reason also. So if you want a good looking teeth, and if you're concerned about the crowding or the teeth, the teeth are not aligned properly, can the teeth aligners can align your teeth? Yes. So to answer your question, do I need teeth aligners? Yes, you do teeth aligners for a variety of reasons. One is to improve not just the function, but also to health of your teeth, and also to improve the cosmetics. And to talk about the function, sometimes when you have teeth that are not aligned properly, then you may not be able to bite, and also sometimes when they're not aligned properly, you may end up grinding your teeth also, which could be a problem. So alignment has to be done for a variety of reasons.
Very important. All right, let's see. Number 24 here, let's see. What causes a permanent tooth to feel loose?
So the question is, what causes the permanent teeth to feel loose? I see for a variety of reasons in my office the permanent teeth can become loose. Simply from the position, like let's say you have the top tooth like this, and then the bottom tooth is like this, and your bite is off. Now you keep pounding every time you bite down. Instead of the teeth meeting like this, you got what we call as a deep bite. So you keep pounding every time you bite down. Now the permanent teeth may feel loose because you keep pounding. And the other reason is, like let's say you have the teeth are meeting properly, but you have severe gum disease. Now the teeth are going to start to feel loose. That could be another reason why, and because you lost a lot of foundation. Or it could be from the braces. You may have completely healthy teeth. Now the teeth were kind of moved fast inside the bone. Now they start to feel loose. So it could be a variety of reasons why your permanent teeth may feel loose. It could be because of the bite, or it could be because you have some severe gum disease, or it could be because you're having braces, or you had braces. So it could be a variety of reasons to why your permanent teeth could be feeling loose.
All right. So if you feel like your permanent teeth are loose and you want to get them taken care of, come on down here to Implants and Gumcare. We'll help you out.
Absolutely. Anytime. If you happen to be in the Dallas-Fort Worth area, come see us and we'll be glad to help you.
All right, let's see. Question number 33 here. What is gum lift surgery?
So the question is, what is gum lift surgery? So let's say, for example, if you have saggy eyelids, right? So sometimes you call it as a facelift because you want the face to look clean or your eyelids to look clean, not saggy. So for some people, we have what we call it as an excessive gum display or excessive gingival display. So when you have a condition called the excessive gingival display or excessive gums, we do have what we call it as a gum lift procedure. We do lift the gums by doing some gingival cosmetic procedure or a gum cosmetic procedure. So now you're not going to have the excessive gum tissue showing, or you don't feel like you have short teeth anymore. So that is what we call it as a gum lift procedure. A lot of times, people come to my office and they say, hey, anytime I take a selfie, I see a lot of gum tissue on my picture. Or my mom says, whenever I'm smiling, or my family says, or my boyfriend or a girlfriend or my partner says, whenever I smile, I show excessive gum tissue, what can be done? So that is when you're going to get the gum lift procedure to correct the gum, the excessive gum tissue.
Okay. All right, let's see. Next question, number 27 here. Is there any age factor for dental implant treatment?
So the question is there an age limit on the dental implant or age limit factor on the dental implant? The short answer is no. However, if we are very, very young, and let's say some people when they are growing up, they still got a missing tooth. They have to go through braces to correct some missing teeth, or maybe correct the spacing for the missing teeth. And if you're less than 15 or 17 years old, if you're a female, if you're less than 15 years old, we don't normally recommend you get an implant at that age. If you're a male, if you're less than 17 years old, we don't recommend you get an implant until you attain age 15 as a female, until attain you age 17 as a male. However, if you're older, there is absolutely no limit unless you have any type of some kind of a medical condition that's going to be a contraindication for you to receive a dental implant. So there is no upper age limit. However, there is a lower age limit to how young you can be to when you receive the dental implant.
All right, so don't send your kids here for that, because they might young kids.
Absolutely, yes.
Yeah.
Yes, sir.
Send your older kids to us.
Yes.
All right, let's see. Let's go to question number 16 here. How does one differentiate snoring from sleep apnea? Does all snoring indicate sleep apnea?
So the question is, how does one differentiate snoring from sleep apnea? Does all snoring indicate sleep apnea? The short answer is not all snoring indicates sleep apnea. So the snoring is one of the indications, several indications to why one may think that person may have sleep apnea. So if you think you snore, and in addition to snoring, whether you feel tired during the day, whether you're not able to focus during the day, and things like that, and whenever you have the certain medical conditions on the top of the snoring and feeling tired, that may translate into you may be at a risk of having a sleep apnea. So the answer is, the short answer is, just because you snore, you may not have sleep apnea. However, if you have other factors, then you definitely want to be tested for sleep apnea. Getting tested for sleep apnea, it's not like as difficult as it used to be. In our office, we sometimes even dispense, we call it as a home monitors, and you're able to wear. And if you feel that you suspect sleep apnea because you sneeze, you snore, you can wear those devices, take it home, and you can wear them, and then you can come out with a test and whether you do have sleep apnea or not. So it not necessarily you have to keep worrying about it. So talk to your dentist or somebody who may be doing sleep apnea in your area. They may be able to administer a test as simple as a take-home test that you can take it home and wear it on you and wear the machine overnight to see whether you have sleep apnea or not.
Mm-hmm. Yeah, if you think you have sleep apnea, do get it taken care of because it can be a life-threatening condition.
Absolutely, yes sir, yes.
All right, let's go to question number 25 here. How do you maintain your oral hygiene all day long?
So the question is, how do you maintain oral hygiene all day long? The short answer is, brush as many times a day and floss as much as you can during the day or before you go to bed or as soon as you wake up. That's a short answer. Just a simple trick. I brush my teeth multiple times during the day, maybe 6 to 8 times. I brush, for example, as soon as I wake up and as soon as I have my breakfast or my smoothie, as soon as after my lunch, as soon as after my dinner, before I go to bed, and in between if I have any type of snacks. So at least a minimum of 5 to 6 times during the day I brush. And then as soon as I brush, sometime I do floss and sometime I don't have to necessarily, but at least you want to floss twice a day, first thing in the morning and before you go to bed. And sometime I do the flossing if I feel like I ate something that the food got stuck in between my teeth. So the short answer to your question is, you're not going to do damage by brushing as many times during the day, or you floss as many times during the day. So how many times it takes? Like I said, in my case, I brush about 5 or 6 times during the day. I floss twice a day. Can you damage your teeth by brushing that many times? The short answer is no. However, you do have a habit of scrubbing your teeth heavily, then you can damage by scrubbing your teeth. So you got to be careful what you do, but as the short answer to your question is, you can brush as many times during the day, at least a minimum of twice a day. You need to floss at least twice a day, a minimum of at least once a day to be able to keep good oral hygiene.
All right, and I bet Sonicare is actually pretty good at helping with that too.
Absolutely, the Sonicare is what Reese is mentioning, and particularly if you have a tendency to aggressively brush your teeth and damage by scrubbing your teeth, Sonicare is a good option. So all you have to do is turn on the power right here. It's a power toothbrush. All you have to do is take it along the gum line. You don't have to necessarily push or put any lot of pressure. And Sonicare has what we call it as a pressure indicator. So for example, if you put a lot of pressure, it makes a different noise. So I don't know how many can hear, but when you put a lot of pressure, it makes a different noise. So you don't put a lot of pressure, that's a good indication. And also, some of these smart toothbrushes nowadays, they are connected to your smart toothbrush. So if you are a gadget freak, or if you're a smartphone freak, you can actually download the app onto your phone, and that actually tells you whether you're putting too much pressure. That way you can control the pressure that you're putting on the teeth.
All right, let's see. Got time for maybe a couple more questions? Let's see, number 38 here. Will an impacted wisdom tooth create nerve damage and tinnitus in the ear?
So, will an impacted tooth create nerve damage and what we call as a tinnitus or tinnitus is the ringing sound in the ear. So the chances of that wisdom tooth causing any type of ringing ear in the ear is very unlikely. However, if you have some pain that is coming from the wisdom teeth, can it cause some kind of a noise in the ear? The short answer is it's possible. So if you have ongoing ringing in the ear, and if you have already seen an ENT or an ear, nose, throat physician, and they have ruled out there is no problem at all, however, you still have the wisdom teeth, I highly recommend you consider removing the wisdom teeth. So that is one part of your question. The second part of your question is, will an impacted tooth cause any nerve damage? The short answer is yes. However, if you have an impacted wisdom tooth, now you got what we call it as a cyst or some kind of an infection developing around the wisdom tooth. Now, can that eventually cause some kind of a nerve damage? Possibly, yes. So, the short answer to your question is, can a wisdom tooth cause any type of nerve damage? Yes, possibly. Can a wisdom tooth cause ringing in the ear? Yes, the answer is yes. For any type of reasons, and if you're concerned, talk to the oral surgeon and see whether you will benefit by having the wisdom tooth removed.
All right. Last question here. Let's go. How do I prevent swollen gums between my teeth?
So how do I prevent swollen? The question is, how do I prevent swollen gums between my teeth? So first of all, you need to know why is the swollen gum happening. So the swollen gum could be happening for a variety of reasons. It could be from gum disease, overall gum disease. You got gum disease, severe gum disease going on, or moderate to severe gum disease going on, or it could be from a broken tooth that you're getting severe food packing that is causing some swelling of your gums, or it could be in the back, which could be caused by your wisdom teeth. The wisdom teeth are starting to grow, or it could be because you have some crowding of your teeth. Now you're not able to keep your teeth kind of clean. Now that may be causing. So the swollen gum could be caused by a variety of reasons, not just one reason. So the best thing is to identify what is causing the gums to swell, and depending on the condition, it can be treated accordingly. And that's the kind of discussion that you want to have with your dentist. What is actually causing the gums to swell? It is a gum disease, or it's a broken tooth, or it is a crowding, or it is a wisdom teeth. So if you just treat just the gum swelling, it is not going to go away, it is going to come back. What you need to do is to treat the underlying condition. If it is a broken filling, you need to fix that. If it is a crowding, you need to fix that. Or if it is a wisdom teeth, you need to fix that. Or if it is the gum disease, you need to fix that. So depending on the condition, once you fix that, then the gum swelling will start to go away on its own.
Mm-hmm. And if you need help figuring out what that underlying condition is, or if you know what that condition is and you need help, come on by us. We'll take care of you.
Absolutely. Happen to be in the Dallas-Fort Worth area, come see us. We will be happy to help you.
Alrighty. That looks like it does it for us tonight.
Fantastic. Thank you so much, Reese, and thank you all for watching. Again, this is the Truth with Teeth with Implants and Gumcare. My name is Dr. Kumar Vadivel. I really enjoy being the host tonight, and this is your place to get the truth with any type of questions that you have on your teeth. And we got several followers from YouTube, on our website, with Quora and Facebook and any type of social media. So you have several options to submit your questions either from our website or with Truth with Teeth. Our website is implantsgumcare.com, or you have the option to submit questions with truthwithteeth.com, or our YouTube channel, or our social media, or Facebook, or Quora. So feel free to submit your questions, and we'll be glad to answer them. Until next time, take care, and we look forward to meeting you guys next month. Thank you so much.
See you next month.
See ya. And thank you, Reese.